I would be delusional to think these cameras out are for me. But absolute honor to be here today in conversation with two of our nation's, not just finest leaders, but patriots. And we're going to have a conversation for the next 30 minutes. I've been told to watch the clock, so I'm watching the clock, to talk about what's the most important thing we can do as a country, which is thinking about an agenda for children. And what country, what democracy, what economy are we passing down to the next generation? So let's just get right into it, starting with you, Secretary, First Lady, Senator, and still my president, Clinton. You've spent your life's work has been about making this country work for everyone, particularly our children. So can you talk about, from where you sit, what does a children's agenda look like in America today?
Thank you so much, Michael. And because we are on a limited time schedule, I actually made some notes because I think it's really important that we try to zero in on what we can do. What is the agenda? And look, I think big picture, every kid deserves a fair chance to live up to his or her potential. And every family deserves the tools and the support that they need to help their kids reach their full potential. So real politics matters. Rhetoric about family values is cheap. And here are 5 places that I would start. And I am thrilled to be sitting next to my friend and the governor, because I first met JB because he was so devoted to early childhood development. And we worked together on that, back in the, Middle Ages. And it was his commitment to children that really made a big impression on me. So number 1, we have to make it more affordable to have and raise kids. It is really hard in today's economy to do that. The cost of living is crushing families. I mean, whether it's rent, diapers, groceries, whatever it is really expensive. Therefore, we need cash support in pregnancy and infancy to reduce stress and improve outcomes. And direct cash payment legislation is something that the governor is pioneering in Illinois. And we need, as I spoke with Nancy Pelosi about earlier, refundable tax credits like the child tax credit, the EITC, to provide direct support to drive down child poverty. Second, we need to support paid family leave, and we need it in the first weeks and months that are critical for babies. Even though our country lacks national paid leave, states like this one, California, show the benefits. We have good data. We have healthier babies, stronger attachments, more stable families. Number 3, we have to support high-quality early care and education. These early years are critical. And we need to be looking for models that work, that are high quality, because if they're warehouse models, they can do more harm than good. So we've got to invest in child care worker training, child care worker pay. New Mexico is the first state to offer universal child care. We've seen expansions in New York and here in San Francisco. That's a priority of Mayor Lurie. We need more preschool opportunities, but again, I want to stress they need to be quality, and we need to make sure that parents are aware of, what they should be looking for so that they get something that is actually going to benefit their kids. Number 4, we have to ensure high-quality physical and mental care for kids. That means protect Medicaid, make CHIP permanent. And I want to say something about the work done by Dr. Nadine Burke-Harris from here in San Francisco, who got the Marian Wright Edelman Award last year. We have to address adverse childhood experiences to prevent long-term health and economic harm, and I'm working with Dr. Harris to do that. And finally, let me say we need to keep our kids safe and healthy, not only in the real world, but in the virtual world. Kids deserve protections online. That's something I've been working on with Common Sense Media through the Clinton Foundation. States are leading the way. We need to do more. And frankly, we need to regulate harmful design, harmful algorithms. We need to hold tech companies accountable. We need to learn about what's happening in places like Australia, Denmark, now Indonesia, what's being proposed in Spain and France and elsewhere. And that's another area where the governor has really been a leader. And finally, in addition to all the things we should be doing, we've got to kind of make kids feel loved and safe and cared for and give them back their childhoods. And I think that's a really important piece of the overall agenda.
It's just lovely to hear a leader who could speak in complete sentences. Thank you so much, Madam Secretary. And Governor, the Secretary mentioned some of the work you have been doing in Illinois. So as you think where you sit as an executive in the state of Illinois, what does a child agenda look like in Illinois? And not saying you have national ambitions, but nationally, what could a child agenda look like in America?
Well, thank you, Mr. Mayor. Thank you very much. And it is really an honor to sit between these two folks. And especially, I just want to say, listening to Hillary Clinton talk about what our children deserve is, well, I think I've certainly been listening to you for 25 or more years now about that. And I'm just so, frankly, to be up on stage with her, to have even close to equal position sitting next to you is an honor. So let me just begin by saying that we are challenged more now than ever before at the state level to address the needs that Hillary is talking about. And it's so, I'm sorry, I should say Secretary Clinton. But I must say, for 25 years before I became governor, I was deeply involved in early childhood development. And I'll just, I think you all understand, but brain development is really, in many ways, what this is all about. There is so much more, but it starts with brain development. If we don't start at the very earliest ages, we're not solving the problem. So saying, for example, universal preschool or even universal childcare is almost missing the broader ambition that we have, which is to make sure that everybody gets an equal starting line in life. And that's not when they're born. It's when children are able to get those early years of support so that they have an equally well-developed opportunity to get ahead. And so we can't begin addressing this unless we're beginning with prenatal care, unless we're beginning with supporting, it used to be called sort of the two-gen solution, but unless we're supporting the parents who are having children, and then every moment of that child's life from the moment that they're born on. And so we're missing a whole lot in this country. And I thought 30 years ago, when I was initially getting involved in early childhood development, that we would be so much further along by now. And it's extremely disappointing that we're not. Let me tell you when I thought we were going to hit an inflection point. In 2006, when I met Hillary Clinton for the first time, or at least got to know you for the first time, and Nancy Pelosi had gotten elected as Speaker of the House, or they were about to take over, and she announced that there were going to be 5 priority areas for her as Speaker of the House, and one of them, for the first time ever among any leader in Congress, early childhood was one of those 5. And when she announced that and Hillary Clinton decided to run for president, and I know how she feels about this, I thought, my God, we're finally going to accelerate to a place where the most trauma-filled communities where kids are being raised will have opportunity. We haven't made it very far in all this time. But let me tell you, when I was on the non-governmental side of this and trying to convince government leaders that this is what we needed to do, I felt like, my goodness, I don't understand why everybody hasn't taken this up already. When I got elected governor in 2018, I thought finally I get to jump over the wall. I'll be on the other side. We'll have Jim Steyer and so many others, showing up, and I'll be like the first yes that they'll get on every topic. And so that's what I've tried to do as governor. That is to say, we've got to, make sure that we're addressing maternal mortality. Black maternal mortality, as probably is 3 times white maternal mortality. That's just the beginning of, working then on, once a child is born, brain development and making sure they've got the needs taken care of. We're doing all of that, addressing it. It takes money to do all that. And at least in the state of Illinois, we were facing enormous, dire fiscal challenges that I had to overcome. But nevertheless, the most important thing you can do for the future of the country is to make sure that these children are growing up with all of the needs met that we know they need. So so much of what we've been able to accomplish has been kind of the models that we created in the philanthropic world, in the nonprofit world. I'm looking at Jim and he's nodding, even though I've got lights in my eyes, I can see. And it's something we've been working on for 25 years and that now finally we're effectuating, at least in the state of Illinois. So it's dealing with child care deserts. We have a big state. There's a whole lot of the state where it's 45 minutes to get to a child care center, right? And that's just not possible for a working parent. And so filling the child care deserts I introduced something called Smart Start in our state, and it's addressing both the needs in child care. Oh, by the way, one of the things we learned during COVID is that so many child care centers closed because when you're providing a subsidy, a voucher-based subsidy for parents, and their child doesn't show up that day or that week or that month because of COVID, guess what happens to the child care center? They close. And when they close for good. So we decided to develop a contract-based support system for child care centers so that even when there's a fluctuation in the number of kids who might come, because guess what, there might be a flu that's going around and a week will go by where a lot of kids don't show up, those child care centers can maintain themselves, and not just during 1 week, but during the entire year, so that yes, the voucher system still works when they show up with a child, but those folks are able to keep their employees and maintain and keep it open. I give you that as an example because there's so much more that needs to be done. We're working toward universal pre-K in our state. We're going to get there, I think, in 2027. That has been our goal, 2027, and I think we're nearly there. All of these things, and there's a whole big long list I'm not going to go through. Secretary Clinton did that a moment ago, but I'll just tell you that we have many states where almost none of what I just described is happening. And yet, from a political perspective, in Republican states, and this is what I did before I became governor, is go talk to the Republican states about this, it saves you money. Investing in our children saves money in the long haul. And there was a guy named Jim Heckman, who was a Nobel Prize winning economist at the University of Chicago, who did the work that shows that for every dollar you invest in early childhood, you save $7 during the life of that child. That's something you can convince, conservative Republican lawmakers to support. And so I believe that we have a real opportunity in this country finally to make the revolution a reality for our youngest children in our most trauma-filled communities. And that's what we're trying to do in the state of Illinois.
And you guys both highlighted things that on surface seem non-controversial. We want kids' brains to develop. Not a bad thing, right? We want mothers to have paid time off so they're able to support kids in the earliest stages of life. And Democrats, Republicans, and independents all were once children and all have kids too. So I guess my question for you all is, what's the political obstacle, or how do we build the political will to actually enact these things that we know work?
Michael, I've said for a long time, children don't have lobbyists. Children don't vote. I used to say when I lived in Arkansas, they didn't take their constituents duck hunting. You can fill in the blank on anything else that brings, legislators and lobbyists together. And the importance of early education is still too often seen as kind of glorified babysitting, because even though we know about brain development, we still have to get that to go viral. People have to understand it. We run a program at the Clinton Foundation called Too Small to Fail, where we have been now for more than a decade working to convince parents, grandparents, others to read, talk, and sing to their infants from the moment of birth to help build those brain cells. And we know, as the governor just said, that investments in early childhood really do pay off. So, Smart Start Illinois under Governor Pritzker, other programs like I mentioned, New Mexico, we know what works. What we still have to do is build both the carrots and the sticks politically. We have to make the case, and as JB said, going and making the case to businesses, not just politicians in states, but we also need some sticks. Part of our problem is that what children need is often not a particularly strong voting constituency. It's a very divided one, where you have families with young children, you have people without children, and so they don't seem to seek common cause. So we have to do a much better job of building that kind of strong constituency for these changes and take them to the ballot box. Have people say, well, to somebody running for legislature or governor or mayor, whatever it might be, where do you stand on these issues? Because that's where I'm going to vote, because that's what's important to me.
And I'll just add that you said there are no lobbyists. That is absolutely true. When you think about what happens in a legislature, in the appropriations committee, where a lot of the decisions get made about how you're allocating resources, young children get thrown into the education bucket. And guess what? There are huge lobbies on K-12 education, but almost no lobby on early childhood education or on early childhood development or even on maternal mortality, right? So there's, nobody fighting for and not only no lobbyists. Remember that the people who need this most are the most powerless people in our society. They're often single parents. They're often people of color. And everybody needs it, but these are the folks who have the most trauma-filled communities with the children who need this care the most. And they literally have no power and no lobbyists. So we have to start with an understanding that in order to make this an issue that people are going to advocate for or make it happen, you've got to educate people who are in office today about why this is important for them to stand up for and make it beneficial to them. So I'm now talking to any of the givers out here. Make it beneficial to them that when they stand up and do the thing that they should do for the most powerless people in our society, they're going to get rewarded by you. And all I can say is that we haven't done a good enough job in this regard, but the fact that there are at least many of us who've been educated over many years and understand that this is the right thing to do, and that we have some power in the world as governor or as a giver or as whatever it is that we've achieved, that, we now have the ability to kind of tip the scales finally in favor of these very, very young children and their families. And it is happening. It's just so much slower than it ought to be. And one last thing. This president and his administration has truly he's put obstacles in the way after all these years of progress. He's put obstacles in the way. And if I sound like I made a joke the other night about, people have said about me that I say, oh, Trump, 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 Trump. I sound like the Epstein files.
That's good. That was a good one.
But genuinely speaking, they're taking away food assistance. They're taking away food assistance from the most needy people in our society. They're taking away health care from the youngest children in our society and, again, the most trauma-filled communities. So we have a lot of work to do, but there are a whole lot of really good people, governors and legislators and legislatures, that are making real progress, and we're doing it at the state level, but boy, do we need to get to it at the national level. Finally, I wish that we were going to have Hillary Clinton run for president, for example. Because honestly, that's what I thought we were going to get, was real change, and we're going to get it. It's just that it's now happening at the state level. Let's keep supporting it there and then take it national.
And Secretary Clinton, in your opening, you mentioned sort of cash support, earned income tax credits, the programs happening in states like Michigan. And when I was mayor of Stockton, we did the first guaranteed income program in this country. So I'm curious thank you, a little bit of applause, thank you. So I'm curious in this conversation about children and child's agenda, where does money and cash play or fit in?
Well, first, Michael, I really want to commend you because you did run the first guaranteed income program, and I think we learned what should have been obvious but had to be proven again, which is that economic security and child well-being are basically the same issue. And it really does incredibly frustrate me when you hear people who are well off, who have all the financial advantages that their children could possibly, have, somehow talking like money isn't an issue. And it is. Let's be honest. It is. It matters greatly. And financial strain directly affects children's development. It affects their stress levels. It affects, because when the parents are stressed over money, the children pick it up. It affects, outcomes. And as I mentioned earlier, the work that Dr. Nanine Burke-Harris does about adverse childhood experiences, whatever other trauma or childhood experience you're going through, the lack of money, the lack of resources to deal with it, compounds it. So, look, I think we're going to have to revisit this issue because AI is going to displace millions of jobs. And, I'm hoping that, like other technology, there will be some new jobs that will be created because of it, or new ways of doing jobs that will still be paid for. But let's be really clear: people are going to lose jobs. They're going to, and the jobs are going to, disappear. And so, how do we deal with what exists right now? Let alone get ready for what is going to be coming down the road at us, and that deserves a whole lot of thinking. I'm doing a lot of policy work and research with, my team at the Clinton Foundation and the Policy Institute there to try to think through, how do we get ready for this? How do we pay for what might be needed? Because we've proven that keeping people at some basic level of income is essential to their well-being and particularly their children. But if that whole system collapses because we lose all of these entry-level jobs, we lose, the kind of jobs that would be there for young people. And I heard this morning on the panel that, our two high school students were on. They're worried about this, and kids should be worried about it because we don't know what's going to happen. So my bottom line is that, Nothing replaces cash in people's pockets to stabilize families, to meet kids' needs. That's especially important, as the governor said, during pregnancy and right after childbirth. It's especially important for early childhood care, and yet we are just not meeting the needs of today, and we are woefully unprepared for the needs of tomorrow.
And maybe we should finally, AI is coming. There's no stopping it, and we're not going to become Luddites and push it away. And so there are going to be changes in our society, but maybe one of the changes that we should welcome and guide is that I think we all believe that child care workers and home care workers for seniors and people who work in nursing homes and care for people, these are service jobs, that maybe we ought to reward people for actually doing those jobs properly. That $7.25, I know we're in California, but $7.25 is the federal minimum wage. That's $14,000 a year. You could work a full-time job and make $14,000 a year. You cannot survive on that. And by the way, many of the lowest paid wage workers are child care workers, home care workers, et cetera. And you can't, by the way, you can hold two of those minimum wage jobs and not be able to pay to survive on your own, let alone a family. So we all ought to be talking about raising the minimum wage and also valuing, especially in an AI, imposed world, valuing service work and work to care for people, like just providing companionship for lonely seniors is like a job that doesn't exist today, but one thing that we ought to be talking about. And then value the work because it takes real skill to be a good child care worker and a good home care worker.
And we have about 3 minutes left, so I'm going to go to closing statements. But I just want to add to that, Governor, and say I think part of what's also missing in terms of building an agenda for children is that the work, the labor is done mostly by women. We have a real problem with sexism and patriarchy in this country. So as we think about an agenda for children, we're talking about an agenda for all people, including women, that allows them to live with dignity and have economic freedom, agency to be caregivers, and also be well compensated in the professions that they are disproportionately represented, the care professions you mentioned, which aren't well compensated.
And if I just may say that the majority of people who earn the minimum wage are black women.
You speak my language, Governor. So 3 minutes left, so let's go with closing statements. If you guys have a charge you would give to this crowd here of thinkers, of leaders, of young people, of more seasoned folks, of people who care about agenda for children in this crazy time we're living in now, what would be your charge to them?
I'm going to go first because I think you should finish. Since you started, she is the closer. I will just say to all of you that we need you to be just like we need you to stand up for people's rights when they're being abridged by this administration and ICE and CBP. We need you to be activists on behalf of the most powerless people in our society, the youngest children who come from the families that are most in need. And I start with that, but just all children, frankly. We need you to be activists. If you're not a giver, show up at your congressman's office, your congressperson's office. Show up at your state legislator's office, your governor's office. Call them. Do everything that you can to make your voice heard on behalf of people who do not have a voice. And I implore you, you're all here today because you care. And I would just say, please go proliferate the care that you've shown by showing up here to other people and recognize that we have to have a revolution on behalf of these very young children. And it's going to take all of us to make that happen. Over to you, closer.
Okay, amen. Look, this is a both and or all of the above moment. We need federal action. We know we're not going to get it for the foreseeable next couple of years. We may get some congressional action if things go well. But we need to be not just focused at the federal level, but at the state and local level. We need to not just be focused at government, but also at business, NGOs, and philanthropy. So for me, we need to do everything we can to protect those vital, foundational federal programs that are going to be under increasing stress. Obviously, SNAP, Medicaid, S-CHIP, et cetera. We also need to be working with state and local leaders to try to make up the gaps as best we can. A lot of those cutbacks that were in the so-called Big Beautiful Bill are going to come into effect at the end of this year, and we need to be prepared for it. We need to be smart about it. We also need to be, once again, using the states as laboratories of democracy. Through the Clinton Foundation, we're working closely with Common Sense Media on protecting kids online, and the states are doing it. Some are trying to stop states from doing it, but that's what a laboratory of democracy means. You've got to get out there and show what can work in states. The same with cities. This city, New York City, Chicago, other cities need to show what they can try to do, both alone and in partnership with their states. And we need, with respect to NGOs, civic action, philanthropy, let's find out what works. Let's not reinvent the wheel all the time. There are programs that work on a lot of these issues somewhere in this country right now, but they don't get taken to scale. And we've got to start doing a better job of figuring out how to take them to scale. We have to do evaluation and analysis because we want to know what works. We don't want to continue things that don't work. But those things that do work, we need to start thinking about how to take to scale. And I think it's really important at this moment to get as creative as possible. We have a lot of evidence about what works for kids, and we need to be in the forefront of taking that evidence, taking the programs that work, building them, founding new ones, creating new ways of working together. So I just want to end by, really challenging all of you to think about what you can do at the local, state, federal level, and so far as that's possible, working with businesses, public-private partnerships, working with philanthropies, working with civic action communities, and not giving up in the face of, what are retreats and pushbacks at the federal level. Because when we have a chance again, and I believe we will, we need to hit the ground running, and we need to institutionalize the changes that work for children and families as quickly as possible and build on them, make them universal, and try to have the kind of future for our kids that they deserve.
Well, hopefully we all listen to you this time. And with that, thank you all, and let's give it up again for Secretary Clinton and Governor Pritzker.